course, I'm talking about coronavirus. We've heard the name, we've heard about how quickly it's spreading, but what is it? What is coronavirus? Where did it begin and why? On this special edition of Healthy Connections, we're going to further explore coronavirus or COVID-19. Hi, I'm Annetta Wilson, your host. And with me today is Dr. Raul Pino, the health officer with the Florida Department of Health in Orange County, to explain more. What is coronavirus?
So coronavirus are a large family of virus. The SARS is in that family, MERS is in that family too. And this is called novel because this is the first time that we know of this virus infecting humans.
So that's a pretty nasty family.
Yes.
How did it get started? There had to be a point of origin.
Yeah, there are some beliefs that may have jumped from the animal kingdom into humans, the same way that HIV did jump from animals into humans. But again, it's very new. We still don't know everything about it. There has been some stories about bat and animal eating and other behaviors that may have contributed to that.
So should we be panicking?
No.
Why do you say that?
So the risks continue to be very low for Florida and for the United States in general. If you look at it, we have 350 million people in the United States. We only have 11 deaths so far, and we have 128 people who are affected by it.
So how is this similar or different from the flu?
We don't know yet. Okay. We don't know if this is going to be seasonal, if this is a one-time infection that is happening. We don't know the scope that this is going to take. But you mentioned the flu, and to put it in perspective, last year 60,000 people died from the flu in the United States. So if you look proportionally, there is a higher chances right now to die from the flu and to get the flu than it is for coronavirus, statistically speaking.
Statistically, okay.
But we understand it's novel. We don't know anything about it. We don't know much about it. And we, of course, have anxiety about it.
So what we do know is prevention as much as we can. Washing your hands, covering your mouth when you cough, because it is spread
through droplets.
Yes.
But also, we know that this particular type of virus right now is not affecting younger people. Okay. Most of the statistics indicate basically that no one under 15 has been affected by it.
So people who are older?
People who are older and people who have pre-existing conditions. Well, it changes. The people who seems to be at higher risk are older than 50, okay, who have pre-existing conditions.
Older than 50, pre-existing conditions.
And that include, diabetes, respiratory diseases, HIV, immunocompromised individuals.
So we're going to have to keep an eye on this, and trust me, we are going to be doing more information segments like this so you can have healthy connections. More to come. Thank you, Dr. Pino.
Absolutely. Pleasure.